Hi guys, welcome back. All right, let's continue our lecture about the cardiovascular system. So let me share my screen. Share. So yes. So last time we talked about the heart, and then from there we talk about the vessels connect with the heart. We talk about the chambers, we talk about the valves, we also talk about the heart wall. And the muscles control or uh, enhance the integrity of the AV valve, the tricuspid and the mitral valve. So we talk about those. And today we are going to start by looking at the artery. So what is artery? Artery basically are the vessels coming from the heart. So those are the vessels carry strong pressure, fluid pressure, because heart, you have artery coming out of you have blood vessel coming out of the heart. Those are the pulmonary artery, and blood vessel coming out of the heart, that's the aorta. You also have vessel coming into the heart, superior vena cava, inferior vena cava, pulmonary vein. Those going to the heart. Those going to the heart is called veins. Even though some of them, majority of them, do not have oxygen or lack of the oxygen or low oxygen, but pulmonary veins do have the oxygen. It's just received oxygen from the pulmonary. But because it transport low fluid pressure, the structure-wise is much thinner. It doesn't really need to concern the pressure applied to the vessel wall. And so this fluid going back to the heart doesn't really have too much of fluid pressure to go through this vessel. So this vessel doesn't is called vein. In contrast, when the vessel out leaving bring the blood out of the heart squeeze on it, the fluid push through, rush through, apply the force on the vessel wall. So the vessel wall has to be pretty thicker, much thicker and stronger to withstand the force applied on the wall. Yeah, so that is the artery. So basically, we're looking to the major artery of the body. This is important, more important than the vein, because artery is the source, the source of the life for those cells. You need to know we are multicellular organism. Each cell is alive, is basically is alive, and they need to be alive. The only way they can be alive is to receive artery oxygenized blood supply. So that is key. Any occlusion, any damage, any lack of the blood supply into that organ will cause organ failure or cell death. Yeah. So that's that important. Um, So you need to keep that in mind. You need to, from this portion of the teaching, you kind of need to understand or realize that what are the vessels to provide the organs that you care. What organs do you care? Which organ? Your lung, your brain, your heart, your muscle, each muscle, your bones, your liver, your kidney. Which organ? Your eyes, your nose? Which organ do you care the most? If you care them all, then you should know what are the arteries to nourishing that organ specifically. So we will touch on that. Yeah. So you need to know that artery receive the oxygenized blood from the heart by transporting those oxygenized blood through aorta. So here is the beginning of the aorta. Here is the semilunar valve, aortic valve. And you can see that it coming from the heart. It going to from the left ventricle. Then it has a turn, then going down. It's pretty long. When it going down, it make a turn. From this 2D view, you don't really get to appreciate it. You thought that, okay, just make a turn, right? This is right side, left side, make a left turn, maybe. In fact, it make a turn like going into the back. It's not hanging in the body, it's going into the back. So it can attach to the spinal column. That structure, that spinal column goes through our body. That rail, in a way, allow this soft thing to attach to it. We have tendon to protect them, attach it. So they don't like hang around. They attach to that solid thing. Yeah. So let's take a look right here. So you can see that from the heart. So here is a mediastinum again. We have the middle portion right here, mediastinum. You have the heart. Too long is not mediastinum. But the middle portion, the lower portion, you have the heart. Um, then you have the trachea. You also have the blood vessel going through. And between the blood vessel, when it going out, aorta going out, it will attach to the spinal column. Just take a chance of looking at this mediastinum. So mediastinum, you have a region called superior, as I mentioned before, superior, inferior, all right? It does say it inferior. So heart is in the inferior mediastinum, and above the heart is superior mediastinum. We can also separate in the heart portion, we can also separate it anterior portion, like before the heart, and then middle mediastinum and the posterior mediastinum, the spinal cord portion. Yeah, so that's the mediastinum. Some other organs that also show you here is thymus. So thymus is the organ to train lymphocyte, T lymphocyte. We will learn about it when we talk about the lymphatic system. We have the trachea, aorta. Yeah, so those are in the mediastinum. Yeah, so you can see what I want you to show you this picture is because I want you to appreciate that aortic arch. We have the ascending arch and then descending. You can see that this one go along with the spinal column to get some support, to get some structure support for this soft tube to go along the long way from your thoracic cavity all the way down into the gluteus, the end of your torso, basically. Yeah. So that's that. So this aorta, you have three segments. General speaking, you have the beginning, you have the ascending. Ascending means arrival, like to your central, like head, and then an arch, like a turn, and then you have the descending. In your descending portion, the descending aorta goes through two cavities. One is the thoracic cavity. Then it would penetrate through diaphragm. I think that's a diaphragm right there here. And then going into the abdominal cavity. And then so your descending aorta has two portions. One is called thoracic portion. This portion is a thoracic aorta. And then beyond the diaphragm, you have the abdominal aorta. So that is the aorta. You can see there are several branch. This one, each of these basically serve the key artery for individual organ. Yeah, so individual organ will get their fluid, their oxygenized blood directly from the aorta. So, let's first look at the ascending aorta right here. So we talked about this one already. So aorta, three portion, we have the ascending aorta, aortic arch, and the descending aorta. Descending aorta, you have the thoracic aorta and abdominal aorta. So let's start by looking at the ascending aorta. What do you need to know about it? The key thing you need to know about the ascending aorta is that it gives a branch of the artery to nourishing your heart, an organ that you care. That's very important because it works every second, whole day, all night. And so that's an organ require take good care of, right? And this organ will receive their oxygenized blood through coronary artery directly branching directly from the ascending aorta. So we can go back to here. We can kind of appreciate it. Yeah, right here, right here, right here, right here. Maybe another picture. Let me see. No, all right. Yeah, so they come from, maybe we have that later. Here we go. So here is the left. So this is the interventricular artery. It separates the right and the left. And so here is the left and here is the coronary, sorry, aorta, ascending aorta. So in the ascending aorta, you can see that you have two branches coming out of it. And these two branches will get the oxygenized blood to nourishing your heart. They will transport this blood going into the smaller artery. It's called arteriole, going to multiple branches, trying to cover the entire heart wall. Your heart has the muscle, your heart has endothelial cells, and your heart also has some other cells. They need oxygen, and this one will provide them those. And so the first thing you need to know about the ascending aorta is that it branching out, it allow the coronary artery branching out of it to nourishing the heart. Another related question is, which artery nourishing your heart? You should know that artery is called the coronary artery. Yeah, there are some other like terminology for these branches of the artery, so you can take a look. Yeah. So that's that. The first thing, ascending aorta, it give out the coronary artery to nourishing the heart. The second thing is the aortic arch right here, aortic arch. So aortic arch is important to provide another three major branches. So you can see here, coronary artery, sorry, let me continue with the coronary artery. Coronary artery will nourish the heart, and the heart muscle use, or heart cells use those oxygen, then it will transport the used blood back to the vein. It will go to the coronary vein, they will collect all these, and then going back to here. So here is the coronary sinus. This is the one to transport the collected, deoxygenated blood back to vena cava, back to the inferior vena cava. And then the blood from the inner vena cava will transport those into the right atrium. Yeah, so just finish up this portion. And then we'll look at the aortic arch, I think. Yes, aortic arch. So here is the aortic arch. So this is a flow chart of this artery. So let me go through this one. Ascending aorta, it gives you the coronary artery, aortic arch, then descending aorta. You have the thoracic aorta, abdominal aorta. In the aortic arch, it gives you 3 branches. You need to know your heart is in the left side. And so when it reach out into the right side, it need additional connection. And so here is the left side. So it's easier to directly give you left carotid, left common carotid artery, left subclavian, but to the right common carotid, right subclavian, you need an additional connection. And that additional connection is called brachiocephalic trunk. Yeah. So the aortic arch will give, it's supposed to give you left and right common carotid. It's supposed to give you left and right subclavian, but because the whole system is leaning toward the left side, so you need one more that connection to allow you to give you right common carotid and right subclavian, and that additional is brachiocephalic. Yeah. So that 3 branches are brachiocephalic, and that will give you right side, left common carotid, and the left subclavian. Yeah, so that's that. From the common carotid, you have left and right. This one will going into your head. From the subclavian, by the name you know it's underneath the clavicle. And this one will give you the blood into the arm. And so from the subclavian, it will go underneath the clavicle, and then it will go through the arm. After pass through the first rib, consider that is reaching to the arm. The artery changed the name. It's continuous artery, but we call it differently now. We call it axillary artery. And then axillary artery will continue into the arm, reaching to the arm. Then it will become the brachial artery and some other artery. The primary one is the brachial artery. And then brachial artery will go into the forearm. We have the ulnar, and the radius. So we have the ulnar artery or ulnar artery and the radial artery. Yeah, so that is that. Same thing applied to the other side of the arm. So so let's first look at the brain. So common carotid. Brain is, I consider that is probably the most important organ in our body in addition to the heart. Heart is important, but brain is very important. Basically, it determines who you are in a way. Yeah. So flow to the head come from the common carotid. But when the blood going to the head, it reach into 2 branch because we have the skull. So the blood either going into the underneath the skull or outside of skull because your facial also need blood. So those require blood supply as well. So when the blood common carotid in the halfway, it will separate into 2 branch. One is called external carotid. The other one is called internal carotid. So here, common carotid, it will become external and internal. External will nourishing your facial, skull, skin. Internal will nourishing your brain. Yeah. So the brain. From common carotid, the internal carotid artery enters skull, deliver blood to the brain, but external is not. So you need to know that the artery nourishing your brain is internal carotid artery. This is critically very important. You need to know because basically question will be which of the following artery nourishing your heart and which of the following artery nourishing your brain. You need to know to nourishing your brain is internal carotid artery. Yeah. So that's that. This one show you this picture. So you have the brachiocephalic, so that is going to your right side, subclavian underneath the clavicle. After passing your first rib, you have the axillary, and then this one will enter into your arm. From the common carotid, you will have external and internal. Internal will going into your brain. The external will going around your skull. So that's that. So right here, external, and this one is internal. And then we also have additional other supportive artery. It will also go into the brain, but more like posterior side. That's the vertebral. Vertebral will go along with vertebral column with this the spinal column and then enter into the brain. So those are the major major blood vessel going around major arteries to nourishing your head, your neck, and also associated with your arm. Yeah. Now talking about the arm, we need to know that it comes from the subclavian. You have the right subclavian, you also have left subclavian. Subclavian will go underneath the clavicle. Passing first rib, you have the axillary. Axillary will then going into your arm. After reaching your arm, it becomes the brachial. Brachial will go along and it will go a little bit superficial where you can do the pulse. You can measure the pulse around like the junction of forearm and arm, so you can feel the position. We also use this portion, this brachial artery, to measure blood pressure by putting a BP, blood pressure cuff, to block it and then release it, and then to measure the pressure. So that's a brachial. And then going into the forearm, and the forearm we have two bones. We have the ulnar right here, and then radius. And so the artery we have the go along with the radius is called radial artery. Go along with the ulnar is called the ulnar. Is called the ulnar artery or ulnar artery. Yeah. So that's the arm, and yeah. So that's that. And then that's the aortic arch. And then the aorta will continue with the descending aorta. The descending aorta will continue go through the thoracic cage. It go basically attached to the spinal column, and then attached to spinal column, following spinal column's direction, passing through the diaphragm, going to the abdominal. Yeah. So, and then in the end, it will branch into the iliac. We have the common iliac, and then common iliac will give you internal iliac and external iliac. Internal iliac nourishing the pelvic cavity, nourishing the back of your thigh or your gluteus. The external will pass through the leg to the front and then going to nourishing your femoral muscles, those muscles in your front side, and also the leg. Yeah, so that is the journey of the aorta. So let's look at the some more detail into this descending aorta in the thoracic. There are a lot artery coming from the thoracic thoracic aorta, and what you can see, we can summarize it here. So here is a thoracic aorta. So basically, it nourishing everything of your chest wall, basically. Yeah. So you have the bronchial, all right, airway. You need some blood supply there. Pericardium, esophageal, uh, and then mediastinal artery, the mediastinal structure. So those basically is branching from the thoracic aorta. Intercostal, the ribs. Superior phrenic, so phrenic refer to the diaphragm, right? Phrenic. And the phrenic are supplied by superior and inferior phrenic artery. So here you see it's superior phrenic and also inferior phrenic. So it should be easy to know those because their artery names give you basically what they are doing. They're nourishing the diaphragm, and the one superior come from the thoracic, inferior actually come from the abdominal aorta. Yeah. So that's the nourishing portion or the artery branching from the thoracic aorta. And then this thoracic aorta will pass through the diaphragm going into the abdominal. Now, abdominal has I would say some key or some large, because the thoracic portion has a lot, but they are pretty small. So you can see that these are kind of smaller artery branching out. They are important. They are directly branching out from the thoracic aorta, but they are pretty small. But for the abdominal, we have a lot of important organs. All these digestive organs are in the abdominal. In the thoracic, you have lung, the heart, but lung take basically the major space. Yeah. The abdominal, you have a lot of organs. Yeah, a lot of key organs. So from the abdominal, one thing is commonly mentioned is the celiac trunk. So this celiac trunk is the very beginning of this abdominal aorta, and this trunk will give you three artery. One is called the common hepatic, going into the liver. The other one is called splenic, going to the spleen. And the third one is called left gastric. This one is going to the stomach. So that's quite important. Celiac trunk, right here, celiac trunk. Another one also very important is the mesenteric. So you have the superior mesenteric right here. Going down here, you have another one, mesenteric, right here. So that is the inferior mesenteric. So you have two mesenteric large vessels. They basically nourishing the small intestine, large intestine. Yeah. So those are the key things that we will dig into it. Some other artery are pretty straightforward, like particularly the renal artery that coming to the kidney. So you can see that just by looking at that connection, you know it's renal artery. We also have suprarenal artery. This one nourishing the glands on top of the kidney. This is called adrenal gland, and is on top of the renal, on top of the kidney. So this artery is called suprarenal. So it's also pretty easy. I box some of this key one, easy to identify, and also should be memorized. Some others are also important. I didn't really box it because to tell which one is which is a little bit like common hepatic, splenic, and left gastric. These three, of course, they are ordered this way, but their branch basically in three-dimensional can be they can be yeah can be can be a little bit alternative, right? Like up down, up way, like upside down or downside up, etc. Yeah. So, but they are also very important. Even though you don't, even if you don't label it, you should know those three branches coming from the celiac trunk. Superior mesenteric, inferior mesenteric should be also very important. And of course, these two branch by the end, common iliac, external, internal, they are like no-brainer. Like you should know that by the end of the abdominal aorta, it split into common iliac, yeah, in the pelvic cavity. Mm. All right. So that's that. And I think almost done with the artery portion. So thoracic, we talked about this one already. The abdominal. So the key thing here is abdominal. This one is a flow chart that basically make it easier to memorize in addition to the anatomy portion. So key thing to memorize is that celiac trunk is from the abdominal aorta. Yeah. So which of following artery come from the abdominal aorta? You should know they include the celiac trunk, include the renal artery, suprarenal artery, inferior phrenic, and we just talked about that. Superior mesenteric, inferior mesenteric. So that's left common iliac, right common iliac. So you should know that. Now, celiac trunk will give you three branch: left gastric, splenic, common hepatic. Liver is on the right side of the body. So if you look at the blood vessel, this is the right side. So this one is tend to be hepatic. So this one is common hepatic. Stomach and the spleen are in the left side. So these two really depends on their 2D layout. It could be they both are approaching. These two are approaching to the left side, but they either both approaching to the left side. Yeah, left gastric and the splenic. So that's that. So you can see common hepatic primary nourishing the liver. They have branching out into the gastric, stomach, etc., etc. Splenic nourishing the spleen, but they branching out also nourishing the stomach, pancreas, The left gastric is primarily nourishing the stomach, the gastric. It also nourishing the esophagus because that one connect with the stomach. So, so this celiac trunk is important in nourishing a lot of organs. The primary ones are spleen, liver, stomach, but also nourishing something nearby, like esophagus, like pancreas, and the duodenum right here. Duodenum is the earliest segments of the small intestine. So they are all nourished by the celiac. Another branch is the superior mesenteric. This one also nourishing a lot of organ and pancreas, small intestine, large intestine. They are all, all these are nourishing by the superior mesenteric. Inferior mesenteric, same thing, in nourishing a lot of these guts, like large intestine. Most of them are the large intestine. So that's that. And the iliac, we will later talk about their flow into the legs. Yeah. So that's that. So here is another picture just to show you their organ. So with this picture, you also see the organ. With this picture, they basically take out the organ, so you get to look at the blood vessel. But with this picture, the organs are showing here. So what you can see here is celiac, common hepatic to the liver, but it also nourishing the duodenum, the small intestine, and the part of the stomach. The splenic right here, it nourishing the spleen right here. It coming down here, nourishing the spleen. The left gastric is nourishing the stomach. You can see stomach, yeah. So that's that. Pancreas, right here. This one, the splenic, also nourishing the pancreas. The superior mesenteric, nourishing a lot of the small intestine and the large intestine. Inferior mesenteric, nourishing a lot of the large intestine. And then again, you have the common iliac, internal iliac, and external iliac. Yeah, so that's that. So this one showing you the three branch from the celiac trunk. We have the common hepatic, we have the splenic, we have the left gastric. Yeah. So common hepatic nourishing the liver, but it branching out into the other end of the stomach, nourishing the stomach. Splenic nourishing the spleen, but they also nourishing this one right here. This one is a pancreas. So they also nourishing the pancreas. The left gastric, they nourishing the some of this stomach, but also right here. This one is the uh, esophagus, the food tube going into the stomach. So yeah, so you can see that this celiac trunk is quite important to provide the blood supply into this important organ. This is the easier one, the renal artery, because you can see that it going into the renal. Suprarenal artery going into the adrenal gland right here. That's the adrenal gland. And you also have a inferior phrenic is underneath the diaphragm. Yeah. So just to show you those connection. You can also see, we didn't talk about the vein yet. You can also see the renal vein basically go following the renal artery. They were going into the vena cava, the inferior vena cava, back to the right atrium. Superior mesenteric artery nourishing a lot of small intestine. Jejunum, ileum are the small intestine, and then colon are large intestine. So they're nourishing a lot of those. Superior mesenteric. Inferior mesenteric also nourishing the gut, but not as many as the superior. Inferior going to the final portion of the large intestine. Like the large intestine will go by the colon, go all the way down, and then this one is called the transverse colon. This one is the descending colon. This one is called the sigmoid colon, and then to the rectum, to the anal canal. Then this is basically poop, like poop come out of it. And then this portion, this final portion is nourished by the inferior mesenteric artery. Its location is in about lumbar colon, lumbar 3 area. Yeah. So that's that. And then we have the iliac, common iliac. Common iliac will give you the internal iliac and external iliac. The internal iliac supply primary in the pelvic cavity. So let me show you back to here. You can see that internal iliac right here going into this is a pelvic cavity. It will nourishing the organs like bladders, uh, yeah. So those in female we have the ovaries and the uterus. They are all nourished by this internal iliac artery. As for the external, internal will also nourishing the butt area because not even though it's outside of this cavity, but in this region, basically in the back of our, because here you have quite big of the opening in the back here, so it will nourishing the butts, like maxima glutea, media glutea, minima glutea muscle, those. The external will going into the leg. So that's the iliac right here. So the common iliac internal going into the pelvic muscle. There are many pelvic floor muscle to hold down this organ. Pelvis, urinary bladder related, reproductive organ, and perineum, like basically like urinary or like a reproductive region, gluteal, and medial, the middle portion of the thigh. Yeah, basically posterior portion, medial portion of the thigh in a way. More like upper portion. The external iliac will go into the femoral, like leg area, and then going further down into your leg. Yeah. So we will look into that right here, external iliac, going to the femoral, the thigh, the frontal portion, anterior portion. It will going into two femoral artery branching into the direct way is going to the popliteal is already to the back of your knee, then the posterior tibia, anterior tibia. For the thigh, you have the deep femoral. This deep femoral will give you some circumflex circulation, like lateral and the medial femoral circumflex circulation. Yeah. So let's take a look. So here is the this one will be the external. This common and then internal. This one will be the external. Then the external will continue with the femoral. right here, femoral artery. But we also have a deep femoral. The deep femoral will give you two circumflex. One is called the lateral femoral. The other one is called the medial femoral circumflex. And then that's a deep femoral. The femoral will then continue with the popliteal going into the back of your knee, and then it will give you the artery into the leg. Let's look at the back because it's going to the back right here. So in the back, femoral, you have the popliteal. Popliteal will give you the posterior tibia, and another branch is going to the anterior tibia. And then that's the two major artery going into your leg. Yeah. So that's the artery to the leg. And that we end the entire the arterial circulation of our body. And I hope it helps. Let me know if you have any questions. The next portion will be about the vein. All right. Bye bye. See you next time.